The quest for biomarkers in kidney cancer has been a long one, and part of that is because kidney cancer really is distinct from other tumor types. It has its own immune biology, its own cancer immunity cycle, and so we can't just recycle TME and PD-L1 and things we might have learned from other tumor types and assume they're going to work in kidney. We really have to study things in a kidney-specific way. And many groups, including our own, have tried to do this, but the way we've done this is by typically looking at one thing at a time. We look at the genetics, and that's it. Or we look at the T cells, and that's it. But we know the systems are much more complex than that. There's factors in the tumor, like PD-L1, but many other things, and there's factors in the circulating blood. And all of those things can come together ultimately to influence whether an individual patient is going to respond or not respond to given treatment. And that's exactly what this analysis tries to do. It integrates some more conventional things like PD-L1 or flow cytometry with some, I think, pretty novel and cutting edge things like an AI-based analysis of H&E slides or circulating extracellular matrix proteins. And then it brings that all together using a machine learning approach to say, okay, if we look at all of these factors at once, which are the most informative, and how do they together tell us about response or resistance? I think one of the big things was that individual factors sort of pale in comparison to combinations of factors. So when we constructed these machine learning models, but only looked at one thing, whether it was PD-L1 or Tregs in the blood or some other factor, there was some ability to predict response and resistance by a little bit, but they weren't very good. When we started to integrate a bunch of these together, and we constructed models both for sunitinib, the control arm, and for nivo cabo, the experimental arm, that's where we really had our power. And we really integrated across 4 domains. We use our AI-powered analysis through PathAI of H&E images, that was one. PD-L1 IHC, immunohistochemistry, 2. Flow cytometry of peripheral blood cells to get their immune phenotype 3, and then 4, the circulating ECM proteins or extracellular matrix proteins. So it was a combination of all of those factors that really gave the best predictive ability. That's definitely one of the features which rose to the top as being one of the sort of top 10 most important things that seem to influence response to nivo cabo, so the immune therapy containing arm. And I think this is supporting kind of this line of thinking that's been emerging in kidney cancer, that it's not just all about the T cells, that these other cell types, B cells and plasma cells, certainly play an important role. Often in the tumor, they'll form these aggregates of immune cells, these lymphoid aggregates. Sometimes, if they're mature, they're called tertiary lymphoid structures. And our group has shown this, but many others as well, that these tertiary lymphoid structures, or lymphoid aggregates, can be really associated with beneficial response to immune therapy. And so I think this is something that's really reinforcing that idea. We're seeing it here again, that it's not just T cells, but it's actually plasma cells rising to the top as an important feature associated with response. It's a great question, and it's something where the honest answer is it's not going to be available for changing practice on Monday, but I think it's coming very quickly because these are all things that are available to us today. H&E slides are available to us today. PD-L1 IHC is available. These are all tests and assays available today. The question is really how to integrate it rather than just looking one thing at a time. And I think what this study does is provide that proof of concept, that sort of framework that if you do that integration, if you really take into account the complexity of the tumor, the complexity of the blood, and put it together, you really have the ability to predict a lot better. So my hope is that this is going to really lay a foundation for the coming years.